So what is the root point? Any other thought process about the question? Please tell your impressions, which will help you to know how you are thinking. Then only a teacher can become a better teacher. So that way you are doing a help to me, to us. So fine. So once we were doing strike during our post graduation. So the strike, the object of the strike was no tuition fee for the postgraduates. They were charging about 4,500 rupees of tuition fee. Then we were all doing strike and sitting. Suddenly one person from the side of faculty came and said, see, we are all teaching you, and come on, get up. You should not be like this. You should become better, and you need to agree for paying tuition fee. Then we told, no sir, we are presenting journal clubs, we are presenting cases. Without that, your knowledge would have been outdated long back. So students' purpose is basically, if how wrongly you are thinking, if I know, I can bring light to the life of another 100 students who are similarly wrongly thinking. That's the purpose of a teacher, right? Only to facilitate. What is your answer? C. Very good. C5 to T1 is what need to be remembered. Hounsfield units, yes. Those who get in top 10 ranks can dream for Usmania Medical College radiology seat. So before you join, our condition is, you know what are the Hounsfield units, where are they, how much are they? Yes. What's your answer? C. D. Anybody else thought anything else? Some innovative answer? No? The mistake is you are having key. We should curtail you of that privilege. 44. That's right. Water by convention, doctor, is 0. Dense bone is 1000 Hounsfield units. Air is minus 1000 Hounsfield units. Blood is 50 to 100 Hounsfield units on CT is what you need to know. What is ring around artery sign? Huh? You thought it as ectopic pregnancy? Very reasonable guess. But one condition is in mediastinum, respiratory system, other is in uterus. Any other thought process? Ectopic pregnancy, very good. Why did you think ring around, ring means you thought gestational ring, artery means uterine artery. Oh, very good doctor, very good, very good. Question number 45. What our online students are saying, they need to punch the answers. They are also part of the today's class. That's good. Ask our students in Tirupati, Kurnool, Vizag also to participate in answering online. Raj proposes pneumomediastinum. Very good. So if you take a lateral chest radiograph, you find a well-defined lucency around the pulmonary artery if there is a mediastinal air, which is called as ring around the artery sign, is what you need to be remembered in pneumomediastinum. So some of your cricketers to whom you are a personal orthopedician had a little problem while bowling, his ligament is torn. Where do you want to push the cricketer into? MRI? MRI has increased the soft tissue delineation to such a wonderful levels that for the shoulder joint evaluation it is considered to be very, very important part of the evaluation. So what is meant by Karnofsky's performance scale? So some of you are going to become MD General Medicine, DM Oncology from All India Institute. So tell me, doctor. So before you start, B or D? B, very good. So before you start the treatment on a cancer patient, you want to know what is his general condition. Why you want to know general condition? So that tomorrow patient will not go and say, because of your drugs I became bad. You can tell your Karnofsky scale was bad, sir, before the treatment only. I mean, I'm telling on a lighter beam, that is not the purpose. So, but Karnofsky scale is to know the general condition. So, if he requires occasional assistance and cares for most of his needs, some score is given. If he is disabled and requires special assistance, some score is given. So it is generally a score for knowing the performance. Now what is dose equivalence? I know what is the most wrong answer for this question. Yes. What is your answer? How many said RAD? I know. Very good. Then what else was your answer? Sievert? Straight away answer. What is meant by dose equivalence, chalo? You must tell me that. Irrespective of the key given to you. Dose equivalence का मतलब क्या है? You have given some radiation, doctor. It is expected to show some biological effects. इतना irradiate करे तो उतना burning हो जाना. The stochastic effects of the radiation are quantitated by this dose equivalence. So dose equivalence is that measure which represents the biological effects of the ionizing radiation or how much. That is graded by using the sievert is what need to be remembered. Now what is the list of the drugs for the post anesthetic shivering? What is your answer? Possible answer? Ketamine you thought. Ketamine is not used you thought because it leads to shivering. It leads to hypertension. Hypertension leads to shivering. Not used means either it should lead to shivering or it is useless for shivering. So what is the reason you thought ketamine? Because one question you expected on ketamine. So that's the reason. You know that analogy in entrance exam. If there is tuberculosis, if you have not answered it as tuberculosis, that's the sinister sin. If you happen to, if the answer is tuberculosis, don't look at any other options and answer TB and come. 100% right. That is the WHO Geneva Convention with the entrance setting guys. So, if tuberculosis is in options, anything, nothing can become the answer. You will remember me while answering in the tomorrow state entrance. So, doctor, ketanserin is not used. So, what are all the drugs which are used? Basically, pethidine, clonidine, tramadol, ondansetron. अरे ketamine इसमें भी नहीं है ना? Pethidine है, tramadol है. Oh, ketamine I also need to check. I thought ketamine was there in this table. Okay, okay. Now, Goodell stages में in the modern anesthesia, Goodell stages are still in practice. That is the opening statement, no? Okay. Stage 3 may plane 1, plane 2, plane 3, plane 4. So examiner picked up specifically one of the planes in the stage 3 and asked you whether you know the definition or not. What was your answer? C? C? Loss of pharyngeal, laryngeal, corneal reflex. Oh. But the answer was pharyngeal, laryngeal, not included was corneal. Okay, let me check. Plane 1 means what, doctor? Onset of automatic respiration to the stopping of eyeball movements, but eyelid reflex is lost. Eyelid reflex means corneal reflex only, no? Okay, वो plane 1 में ही चले जाएगा. अगर plane 2 में आ गए तो देखेंगे. So, eyeball movement cessation to the beginning of paralysis of intercostal muscles. Laryngeal reflex is lost. Corneal reflex disappears. So what should be the answer? See. Oh, very good. Not only Dr. Murali Bharadwaj papers will have wrong key. So even his students' papers also will have wrong key. So no problem. That way C should be answered, no? We will try to bargain with them to change the, do a correction in the key. Now, to reverse the rocuronium effects, which drug is basically used? Huh? Sugammadex or suxamethonium? What was your answer? Okay, give me honest opinion. How many today only came to know this word called Sugammadex? Oh my God. It sounds like that last pages of the Deccan Chronicle where to improve your impotence use a drug kind of a drug. the name Sugammadex. So I was also listening first time, honestly, but that was the answer. So what is Sugammadex? It is a selective relaxant binding agent is the class it belongs to, SRBA. It is for the reversal of the neuromuscular blockade by the agent rocuronium in the general anesthesia. Now what is the normally if you use acetylcholine esterases also, you can be able to inhibition of acetylcholine esterase also, you can increase the acetylcholine levels and reverse. But what is the advantage of the Sugammadex? It can reverse a neuromuscular blockade without relying on the inhibition of the acetylcholine esterase. Hence it is the very good drug. And it does not lead to any autonomic instability, which is the problem if you happen to use a inhibitor of the acetylcholine esterase, is what need to be remembered.